Pag-uusapan natin. This is Dr. Jun Reyes, and po sa hindi pa yung mga bago pa lang po dyan sa channel natin. My name is Dr. Jun Reyes, your physical therapist. Ang pag-uusapan po natin is about vertigo or chronic dizziness. Pagka sinabi pong vertigo, it's a symptom. Hindi po siya diagnosis. Alright? So, ang mga dahilan kung bakit po nahihilo ang ating mga seniors or kung bakit tayo nahihilo, madami pong dahilan ito. It can be a central component or it can be a peripheral component. Ang good thing about that is mas common po ang peripheral dysfunction or peripheral vestibular dysfunction. Mas common po yung dahil po meron tayong inner ear dysfunction or dahil po meron tayong crystals that displace in one of the canals or nagkaroon tayo ng trauma dun sa inner ear natin. Nagkaroon tayo ng infection, it could be vestibular neuritis, or nagkaroon tayo ng concussion kung bakit po tayo nagkaroon ng displaced crystals sa ating each ear. Kasi we have three semicircular canals on each ear. So tatlo on each side. So 3 canals here, 3 canals here. So pagka meron dysfunction sa canals or dysfunction sa right ear or left ear, nagkakaroon tayo ng asymmetry, hindi pantay ang signals na pumupunta sa brain. Pag-usapan natin kung bakit tayo nahihilo, ano po? Ang pag-usapan ko dito is a peripheral dysfunction. Ibig sabihin, weak po yung right ear or left ear, or pwede rin tayo may crystals displaced on one of the canals. Kung bakit tayo pagka tumutungo or nag-lie down tayo, nahihilo tayo, nagkakaroon tayo ng vertigo or spinning sensation. So, ang peripheral component, pagka merong weakness dito sa right ear, this is my right ear, tapos normal tong left ear ko. So, mahina dito, nagkakaroon ng wrong signals going to the brain. So, malakas to, no? Strong tong side na to, and then weak itong right ear ko. So, ang sinasend na signals, hindi diretso. Mahina dito sa kanan, malakas dito. So, nagkakaroon ng wrong signals kung bakit tayo nagkakaroon ng dizziness. Isa din sa mga dahilan, minsan yung canal, yung crystals or calcium carbonate na pupunta sa posterior canal. So if we bend over, nagki-create na naman ng error signals or wrong signals. Ang sinasabi ng ulo, we're looking up. Pero ang ginagawa natin, we're looking down. So nagkakaroon tayo ng error signals or wrong signals papunta sa central nervous system. Yan po ang mga dahilan kung bakit tayo nahihilo. Yung mga common po ito sa mga seniors pag pumupunta sila sa kanilang primary care doctor. Minsan ninenervyos sila. Kala nila nagkakaroon sila ng stroke kasi nagkakaroon ng vertigo kasi spinning sensation po yan, ano? Nakakatakot siya. Akala nila nagkakaroon sila ng stroke. Isa po yan sa mga dahilan kung bakit pumupunta ang mga pasyente or ang mga seniors sa kanilang primary care doctor. Dahil po sa crystals or dahil sa infection of the ear or ears. Ano pa ba? Yon. So, i-describe ko kung ano ba yung dizziness kasi napaka-wide, madami pong description ng dizziness. Kasi pag sinabi nating vertigo, isa lang po yan sa mga description ng dizziness. Pag sinabing dizziness, meron po yung feeling of balance, unsteadiness, disequilibrium, lightheadedness, and vertigo, yung spinning sensation. Yan. So, pagka kailangan as a clinician, malaman natin ang right diagnosis. Lalo na sa Philippines, napakamahal po. Alam nyo, pag nagpatingin kayo sa doktor nyo, babayaran nyo yung consultation. So, nag-aalala kayo na baka nagkaroon ng stroke ang lolo't lola nyo. So, ang gagawin ng primary care doctor, if they're not experience dealing with dizziness, i-recommend nila yung MRI, CAT scan. They would refer them to ENT doctor, to a neurologist. Napakalaking gastos po niyan, ano? Libo-libo. Usually, it would cost you maybe around 10 to 20,000. Hindi pa nila alam ang diagnosis. Alright? So, eto nakakatipid kayo na makakatipid kayo kasi I'm gonna show you paano natin ma-diagnose ito. Lalo na po ang benign paroxysmal positional vertigo, napakabilis i-cure nito. So, balik tayo sa primary care doctor. So, pagpunta sa primary care doctor, magpe-prescribe sila, go see an ENT doctor or neurologist. That's gonna cost you an additional 5,000. And then you're gonna go for an MRI. So, it's gonna cost you a lot of money. So, itong ituturo ko sa inyo, matututunan nyo ngayon, paano nyo malalaman kung simpleng benign paroxysmal positional vertigo. Mamaya po yan, matututunan nyo. Makakatipid kayo ng inyong pera. Yan. Alright. Ang mga dahilan kung bakit tayo nagkakaroon ng vertigo, usually peripheral component. Ano naman yung central component? Bakit tayo nagkakaroon ng dizziness? Ang mga central component, bakit po tayo nagkakaroon ng dizziness, is number 1, stroke. Alright? Kung naapektuhan, kaya tinawag siyang central component, dahil central nervous system, yung brain natin naapektuhan. Kaya tayo nagkakaroon ng dizziness. Multiple sclerosis. Pag may tumor sa brain, nagkakaroon tayo ng dizziness. Or plaque formation like the multiple sclerosis. O nagkaroon tayo ng concussion, that's also a central nervous system. Kung wala naman siyang benign paroxysmal positional vertigo. Hypoglycemia. Pagka may diabetes, hindi tayo kumain, nagra-rush tayo sa umaga, we're exercising, no? Yan, common po yan na magkaroon ng dizziness. Lalo na, pagka nag-increase tayo ng dosage sa medication, uminom tayo ng blood pressure, your calcium channel blocker, your ACE inhibitor, yung mga increase ng dosage sa kanilang blood pressure, uminom sila, nag-low blood pressure, magkakaroon kayo ng dizziness. Yeah. And other medications, yung side effects sila, nagkakaroon tayo ng drowsiness or dizziness. Okay pa? Ayan, tinatalakay natin yung central component and the peripheral component. Okay, so alam niyo na kung bakit tayo nagkakaroon ng dizziness. Now, paano natin iti-treat ang pasyenteng may chronic dizziness? Ito, I'm a vestibular specialist. I finished my vestibular certification. I've been doing vestibular therapy for 11 years now. So, halos lahat na na-encounter ko dealing with vestibular problem. Yung mga pasyenteng may dizziness, I dealt with central component and peripheral component. Ngayon, ang matututunan natin, ano-ano ba ang pwede nating gawin. So, for example, vestibular neuritis. So again, pag may vestibular neuritis, tinatawag po ito na infection of the vestibular nerve. So yan, matindi yan, nagsusuka. It can be from a stomach virus, no? Nagkaroon tayo ng inner ear infection. Yung virus, same virus sa stomach natin, na-trigger yung virus sa inner ear natin. So nagkaroon tayo ng vestibular neuritis. Again, magkakos ng vertigo or unsteadiness. Ititreat lang natin yung pasyente pagka hindi na malala yung symptoms. Ang unang gagawin is rest. And then pagka gumagaling na yung pasyente, they can start walking and then they have to see a physical therapist. Again, kung may vertigo kayo, make sure you see a vestibular specialist, a physical therapist specializing in vestibular rehab. Okay. Ano ba yung mga basic exercise? I have another dizziness is it can be from cervicogenic dizziness. You may severe osteoarthritis of the neck. Common po ito sa mga senior citizen, usually peripheral component or cervicogenic dizziness po. Okay? Alright. So mag-start tayo. If we have chronic dizziness, mag-start tayo ng basic exercise. Umpisa na tayo ng treatment, okay? Ito na po yung treatment natin. Ang basic exercise pagka may chronic dizziness, we start with 10 repetitions of up and down head turns, okay? Up and down movement of the head. Okay, 1, 2, 2, 3, 3, 5, 6, 7, 8, 9, and 10. We do this 2 sets of 10. All right, again. 1, okay, 2 sets of 10. Remember, this is for patients laging nahihilo, chronic dizziness. I'm a vestibular specialist, so usually we can trigger the dizziness. Not severe. You can do this just 10 repetitions. Just do it slowly. Wag po nating bibilisan masyado. Dahan-dahan lang po, okay? Gagaling din po kayo as long as you follow this exercise. Para sa inyo po ito. Gawin nyo lang ito consistently every day for 2 weeks and you'll get better. Now, after 10 repetitions, we're gonna do head turn side to side. 10 repetitions, 2 sets of 10, okay? 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, again, 2 sets of 10. We're gonna do 1 more set. Okay. Four, 5, 6, 7, 8, 9, and 10. Alright. Kung hanggang dito lang yung movement, it's okay. Alright? Kung hanggang dito lang ang movement, it's okay. If you can only move this way, it's okay lang po. As long as you push yourself as far as you can go. Okay po? Yan. Importante, we move the head side to side. 2 sets of 10, 10 repetitions. Alright. We did the up and down. We did the side to side. We're gonna do the tilt, side bending. Okay? 10 repetitions, 2 sets of 10. 1, 6, 7, 8, 8, 9, 9, 10. Okay, 10 repetitions, 2 sets of 10. Alright, another one, I like to do this chin tucks. Kasi nabanggit ko sa inyo kanina, dizziness can be coming from your neck. So you're gonna do chin tucks. Alright, we're gonna do this 2 sets of 10 again. 1, you can put your hand right here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, that's 2 sets of 10. You do chin tucks, 10 repetitions. Okay, now we're gonna do an advanced exercise. Alright? Madali lang po itong gawin dun po sa mga pasyenteng nahihilo. Okay? This is what we call gaze stabilization exercise. Alright? So we're gonna concentrate, look at the target. Ito po yung target. You can use your thumb, you can use a business card. Pero ito yung target. We're looking at, this is what we call VOR exercise or gaze stabilization exercise. Alright? So we're gonna turn, I'm gonna turn my head side to side and keep looking at the target. Alright? Don't move your eyes away from the target. And you're gonna do this slowly. Start with a slow motion. And your range of motion would be 30 to 45 degrees range of motion. Alright? Just like this. Pagka nahihilo, okay lang po yun. Kailangan, ito po yung, you gotta push through that dizziness. Kailangan, huwag naman yung sobrang hilo. Alright? May hilo po talaga kayo dito. Kasi ang purpose of doing this exercise is to make you dizzy, to habituate. Kasi ang purpose of doing this, you're gonna be asking me, Doc, lalo ako may hilo niyan. Yung po idea, when you do vestibular exercises, when you do vestibular rehab, the purpose of doing this is habituation or adaptation exercise. When you say adaptation, nagsasend tayo ng signals going to the brain. Oh, I've been doing this over and over again. We're bombarding these signals to the brain. Masasanay na ngayon yung brain natin with that movements. So nagkakaroon ng decrease ng symptoms and dizziness. That's the purpose of vestibular therapy. To make you dizzy, but therapeutic dizziness. When you say to make you dizzy, vestibular rehab, we're gonna bombard the brain with active range of motion, with habituation, adaptation. Nag-a-adapt ngayon ang brain natin. So we lessen the symptoms of dizziness. Okay? Yan po ang dahilan kung bakit natin to ginagawa. So I joke around, my patients, oh, you get paid to make me dizzy. Okay? So yan po ang gagawin natin. So we did 30 seconds side to side. We're gonna do up and down naman. Ganyan. Okay? Up and down. Ito yung target. (30 seconds to a minute), up and down, 30 to 45 degrees range of motion. Okay? Okay, 30 seconds. Yan po yung VOR1, gaze stabilization exercise. Now, we're gonna do a VOR cancellation. Okay? Ito yung, ipa-follow nyo lang yung target with your eyes. So, you're gonna go this way. VOR cancellation. I'm not sure if you're following me, okay? Ayan, lalayo ako. Alright? So, ito yung target ko. We're gonna, ipa-follow ko siya, ganito. Alright? Ito po, common ito, lalo na dito sa New York, we're doing vestibular rehab. I'm doing it here at Reyes PT. Continue doing this. Very effective. Again, you're gonna get dizzy with this one. But the purpose of doing this is habituation exercise. VOR cancellation, just like that. And we're going to do this for 10 repetitions, 2 sets of 10. Again, up and down, up and down, up and down. Okay, so those are the exercises. Alright, another one, if you have a checkerboard, ito naman po yung checkerboard. Ayan tinuturo ko sa inyo yung mga advanced technique. So kung hindi nyo pa kaya doon sa mga movements na yun, dahan-dahan lang. You maybe start with active range of motion and then next week you do the advanced exercise, the VOR1 or gaze stabilization exercise. And now you can progress with the checkerboard. Now itong checkerboard na ito, I'm looking at the target. Ang purpose ng checkerboard, this represents your surroundings. It makes it look busier. Alright? Ibig sabihin po niyan, nilalagyan ko siya ng visual stimulation. So maglalagay kayo ng letter B or any kind of letter. Yan po ang magiging target nyo. Okay? Ang magiging target nyo. So ipa-follow nyo lang yung target. Alright? I'm gonna look at the B and then I'm gonna move my head side to side. You can see my eyes are not moving away from the target. So you can see that. We're gonna do this 30 seconds to a minute. Pag magaling na kayo, you can do faster movements just like this. Yeah. Again, pag mabilis, that's gonna make you dizzy. Alright? Again, we're gonna do up and down. Remember, up and down. After doing side to side, up and down naman. Yeah. All right. Do those exercises consistently for 2 weeks. Those are advanced techniques. Those are effective based on evidence-based research, evidence-based practice. If you do those exercises, magdi-decrease po yung dizziness nyo. It takes time because it's an habituation, it's an adaptation exercise. Yan po yung mga advanced treatment. Pagka magpapapiti po kayo niyan, nako, napakamahal po. Usually, I think 2,500, 3,000 per session. So imagine, if you're doing this at home, libreng-libre po, ha? Libre na yan. Alright, so ano pa ba yung nagkakos ng dizziness? Nagkakos po ng dizziness, yung tinatawag nating cervicogenic dizziness. Tapos meron tayong headaches, nahihilo tayo kasi meron tayong cervical spine osteoarthritis C1, C2. Ang ginagawa ko, mag-i-stretching tayo muna. Mag-stretching tayo ng neck muscles and then i-massage natin yung batok natin, yung upper C1, C2 or the base of the skull. Ito po, ha? Alright. Ang ginagamit ko dito sa Reyes Physical Therapy, very effective. Itong aking 2-ounce Dr. Reyes Liniment Cream. Yung maliit lang siya, oh. Maliit. 2 ounce lang siya. Pwede niyong gamitin pagka nagda-drive kayo. Very effective po siya sa mga pasyenteng may dizziness. I would use this sa temporal area right here. Yan. And then all the way sa batok. Tapos itataas yung ngayon, ano? Ayan, hihilahin nyo. Doon po sa may wala pang Dr. Reyes Liniment Cream, you can use coconut oil with ginger. Coconut oil with ginger, very effective po siya. Okay, thank you sa mga nanonood dyan. Again, Dr. Reyes Liniment Cream, i-massage dito. Yan o, napakasarap saka. I like yung smell. Mabango siya. Ayan, ilalagay nyo all the way to the TMJ. Yan. And then all the way behind your ears. Yan, yung mga nahihilo dyan, ilagay nyo lang, i-massage nyo lang po yun. Behind the ears, just like this. Yan. Tapos all the way dito sa upper traps. Yan, ganyan, pataas. And then behind your ears. And then all the way to the anterior neck muscles. All the way to the chest area. All the way right here. Yan, tapos i-combine nyo lang ng inhale, exhale. Lalo na yung smell niya, it's really strong and relaxing. Alam niyo, ginagamit ko to every day. Tapos ilalagay niyo, amin yung ganyan. Open up, tapos stretch nyo. Ilagay niyo yung kamay niyo ng ganyan. Stretch, and then do some roll movements. Yan. Lalo na, sabayan nyo ako ha. Doon sa mga nanonood dyan, you can watch me, especially pagka yung neck nyo stiff. Yan po ang dahilan dahil tayo nahihilo. Yung mga seniors, sa mga lolo't lola, sa mga OFW na laging nahihilo, napakahirap po ito, no? Yung laging nahihilo kasi hindi tayo makapagtrabaho. Actually, dizziness is, for me, is more debilitating sa sprained ankle, sa low back pain. I'm not minimizing your condition, pero based sa aking experience, if you're dizzy, you can't function. And then, you can't do anything. You can't work. Alright? So again, ito pong Dr. Reyes Liniment Cream. I've been using it for 5 years. It worked sa mga pasyenteng may dizziness. It's just the combination of massage and working that muscles all the way. Ipupul nyo po yung neck nyo, no? Ipupul nyo pataas. Ganyan. Like 30 seconds. Hold it for 5 seconds and you do this massage for 30 seconds dyan lang sa base of the skull. Ipapakita ko sa inyo, ha? Ganyan, no? Pataas, ipupul nyo pataas. Lalo na dito. And then behind your ears, ilalagay nyo, ikot nyo dito, behind your ears, just like that. And then pataas for 30 seconds. Ayan. Yan po. Okay. Whew, that was good. Tapos stretch natin tong chest muscles natin. Lagay natin yung Dr. Reyes Liniment Cream or your coconut ginger oil. Ilagay nyo lang dito. Ganyan. Okay, pag ganyan. And then circular motion going 3 sets of 10. Just like this. Yan. Thank you nag-send ng stars dyan. Okay, so rotation. And then last one, stretching. Ilagay nyo yung kamay dito sa likod nyo. Alright, stretch just like that. Hold it for 30 seconds. Combine nyo rin ang inhale, exhale. Yan, ganyan. And then back, going this way. Stretch natin. Yan. Upper traps. And hold it for 30 seconds. You do that for 3 repetitions. Okay. Good. 30 seconds. And then back. Last one. Going this way. 3 repetitions. Yan. Nako, thank you sa mga nagsasend ng stars dyan. Thank you for your donation, for sponsorship. Talagang nagpapasalamat ako sa inyo. Ayan. Alright, so 30 seconds hold and each 3 repetitions. Alright, now, yan po yung mga basic exercises sa mga pasyenteng may chronic dizziness. Very effective po siya. Gamitin ninyo yung stretching and then Dr. Rest liniment cream. Eto, paano ba natin ibabalik yung crystals where it belongs? Yung may displaced crystals. This is what we call benign paroxysmal positional vertigo. Last na po ito. Ito po yung may BPPV. Very common po ito sa mga seniors. Like pagka umupo or natulog, they're gonna experience vertigo or nystagmus. Pagka sinabing nystagmus, yung mata umiikot na ganon. And then the surrounding spinning sensation. Now, let me see if I can change the angle so I can do presentation ng BPPV. Okay? Alright. I-adjust ko lang po. I-adjust ko lang yung angle nitong ating camera. Okay. Tingnan natin ha. Ito, pwede nyo pong gawin ito sa bahay. So, ayan. Okay, na-adjust ko na. Pwede nyo itong gawin sa bahay. It will save you thousands of pesos. So, i-share nyo po ito sa inyong family members. This is what we called Epley's maneuver or canalith repositioning technique. Alright? CRT. Alright. Now, it's... Okay, ganito ang gagawin natin. For example, I did the Dixolpike testing. So this is my right side, this is my left side. So nag-Dixolpike testing tayo. Ang Dixolpike testing, nakita na positive tayo sa right ear. Okay? So nagkaroon tayo ng benign paroxysmal positional vertigo sa right ear. So ang iti-treat po natin is the right ear. Okay, higa na ako. So ito yung right ear ko. I have BPPV or benign paroxysmal positional vertigo sa right ear. I'm going to put my arms across my chest. I'm going to turn my head to the right. Okay? I'm going to experience dizziness as soon as I lie down. Alright? Ready? I'm going to turn my head 45 degrees range of motion going this way. I'm going to go down. Alright? Pag positive ako, it's going to have a spinning sensation. May vertigo yan, the right ear. So we hold it for 30 seconds until the symptoms of dizziness subside and then additional 30 seconds, okay? Hold it for 30 seconds after nung symptoms of dizziness. Yan, hold lang tayo ng 30 seconds. After 30 seconds, I'm gonna move my head to the left side, alright? To the left side, again, hold it up until the dizziness subsides, additional 30 seconds. Alright? Now I'm going to tilt my head towards my shoulder and then I'm going to roll. After the symptoms of dizziness subside, additional 30 seconds, mag-roll tayo to the left. Maintain nyo lang yung head nyo looking down 90 degrees towards the floor. Ganyan, 90 degrees, naka-tilt pa rin, naka-chin tuck pa rin doon sa left shoulder. 90 degrees, okay? Hold it for additional 30 seconds after the symptoms of dizziness subside. Alright? Usually mga 30 seconds to a minute ito. Importante, we're not moving our head. Don't change your movement. Don't change your head movements. Huwag babaguhin ang position ng head. Alright, maintain it for 30 seconds until the symptoms of dizziness subside. Alright? After that, slowly push yourself into sitting. Sit up. Alright? And then turn your head into a neutral position. Napakadali po nito. Alright? Make sure you hold sa table or sa bed ng ganyan. Kasi minsan nahihilo tayo. We're gonna lose our balance. Yan. Okay. Ayan po ha. Ayan po ang ating okay, tapos na po yan. Tapos na po tayo. Yan po ang ating kumpletong topic. Paano natin matitreat ang mga pasyenteng may vestibular dysfunction and pasyenteng may benign paroxysmal positional vertigo. Sana nakatulong po ito sa inyo, lalo na sa ating mga lolo't lola, sa ating mga magulang dyan. Kung may time kayo, mag-subscribe kayo sa YouTube channel ko, Dr. Jun Reyes, PT, DPT.